Did you know that the itch you experience as you age could be a sign of something much more serious than just dry skin? Surprisingly, itchy skin or certain areas of discomfort in seniors can be an indication of underlying health conditions that might affect your longevity. As we grow older, our bodies go through various changes, some of which can show up as seemingly minor symptoms, like itching. But did you know that certain itchy areas could actually be warning signs of bigger health issues that could shorten your life? In this video, we'll explore 8 itchy areas that should not be ignored by seniors. After watching, you'll understand why these areas could be more than just uncomfortable and how you can take action to protect your health and potentially increase your life expectancy. Now, let's dive into these important areas and their potential implications. Point 1. Itchy feet and legs. Itchy feet and legs in seniors are more than just a minor annoyance. They could be a sign of poor circulation, which becomes increasingly common with age. As we grow older, blood vessels can lose their elasticity, leading to reduced blood flow, particularly to the extremities. This condition, known as peripheral artery disease, PAD, causes the blood vessels in the legs to narrow and harden, restricting blood flow to the muscles and tissues. As a result, the skin on the feet and legs may become dry, irritated, and itchy, which is a common complaint among seniors. Scientific studies support this connection between itching and circulation problems. A 2017 study published in the Journal of Vascular Surgery highlighted that PAD not only causes discomfort in the legs but can also lead to more severe complications, such as leg ulcers, muscle weakness, and even the risk of amputation in extreme cases. This condition often manifests as pain, cramping, and a sensation of heaviness in the legs, alongside itching. Without proper treatment, PAD can further reduce mobility and the quality of life, making it more difficult for seniors to stay active, which can, in turn, shorten life expectancy. For instance, consider the case of Edward, a 72-year-old man who began noticing that his legs were itching, especially after sitting for long periods. Initially, he thought it was just dry skin, but the itching became more persistent and was often accompanied by a tingling sensation. After visiting his doctor, Edward was diagnosed with early-stage PAD. His doctor explained that the poor circulation in his legs was causing the itching, and that without proper management, it could lead to more severe complications. Edward started a treatment plan that included lifestyle changes such as walking regularly, taking medication to improve circulation, and following a diet low in fats. Over time, the itching decreased, and he felt more energized and less uncomfortable. This example underscores the importance of paying attention to seemingly minor symptoms like itching, especially when they appear in conjunction with other signs of circulatory problems. Addressing these issues early can prevent more severe health consequences and help seniors maintain better overall well-being. Point 2. Itchy scalp. An itchy scalp in seniors can be more than just a sign of dandruff or dry skin. It could indicate underlying skin conditions such as psoriasis, eczema, or even fungal infections like ringworm. As we age, our immune system becomes less efficient, making older adults more susceptible to these conditions. For example, psoriasis is a chronic autoimmune condition that leads to the rapid turnover of skin cells, which can result in itchy, red, and flaky patches on the scalp. Similarly, eczema, another common condition in seniors, causes inflammation of the skin, leading to irritation and itching. Scientific studies have shown that these skin conditions are prevalent among older adults. A study published in Dermatology Reports pointed out that up to 20% of older adults experience some form of eczema, with many of them suffering from itchiness and discomfort as the primary symptoms. The immune system's decline with age means that conditions like psoriasis or eczema are more difficult to manage, leading to chronic itching and sometimes secondary infections if the skin is scratched too much. In some cases, untreated scalp conditions can lead to hair loss, as the persistent scratching damages hair follicles and inhibits new hair growth. Take the case of Helen, a 68-year-old woman who noticed an increase in scalp itching. Initially, she thought it was just dandruff, but as the itching became more intense, she also started to notice scaly patches on her scalp. Helen's doctor diagnosed her with seborrheic dermatitis, a form of eczema that commonly affects the scalp. She was prescribed a medicated shampoo, along with topical treatments to reduce inflammation and control the condition. Over time, the itching subsided, and her hair began to regrow as the inflammation reduced. Helen's story demonstrates the importance of addressing itchy scalp conditions early. While it may seem like a minor issue, persistent scalp itching can signal an underlying condition that, if untreated, could lead to greater complications. By seeking proper medical advice and treatment, seniors can manage these skin conditions effectively and prevent further discomfort or health issues. Point 3. Itchy hands and feet, palmoplantar erythrodysesthesia. Itchy hands and feet, particularly on the palms and soles, may seem like an ordinary irritation, but they could be a sign of a condition known as palmoplantar erythrodysesthesia, PPE, or hand-foot syndrome, which is often associated with certain medications. This condition occurs when there is a reaction in the skin, causing redness, swelling, burning, and itching, especially in response to chemotherapy drugs, though it can also result from other medications. The skin on the hands and feet becomes inflamed, tender, and may itch intensely, sometimes even leading to blisters. For older adults, this symptom is particularly concerning as it can interfere with their daily activities and mobility, and if left unchecked, it could lead to more severe skin damage. Scientific studies have confirmed the connection between medications and itchy skin in seniors. A study in the Journal of Clinical Oncology found that approximately 30% of patients undergoing chemotherapy experienced some form of hand-foot syndrome, with itching and discomfort being the most common early symptoms. In older adults, the body's ability to handle medications can be compromised due to slowed metabolism or pre-existing conditions like liver or kidney disease, making them more susceptible to side effects like PPE. For example, take the story of Richard, a 75-year-old man who was undergoing chemotherapy for cancer treatment. After a few weeks of treatment, Richard began to notice an uncomfortable itching sensation in the palms of his hands and the soles of his feet. The itching became so intense that he had difficulty walking and using his hands for daily tasks. His doctor confirmed that he was experiencing hand-foot syndrome as a result of the chemotherapy. Richard was advised to take a break from the treatment regimen and was given a topical steroid cream to reduce the inflammation and itching. His doctor also provided him with additional strategies, including adjusting his medication dosage and incorporating moisturizing lotions to protect the skin. With proper care and intervention, Richard's symptoms improved, and he was able to continue his treatment with reduced discomfort. Richard's experience shows how important it is to monitor any new symptoms, like itchy hands and feet, especially if you are on medications. Recognizing this condition early and consulting with a healthcare provider can help minimize the impact of these symptoms and allow seniors to continue with their treatment safely, avoiding more serious complications. Point 4. Itchy skin on the abdomen and back. Itchy back or spine in older adults can often be dismissed as simple dry skin or muscle tension, but it can sometimes indicate more serious underlying conditions such as nerve damage or a condition called shingles. As we age, our skin becomes thinner and loses moisture, leading to dryness and irritation. However, persistent or severe itching along the back or spine could be a sign of a condition called postherpetic neuralgia, which often follows an outbreak of shingles. Shingles is caused by the varicella zoster virus, the same virus responsible for chickenpox. After an initial chickenpox infection, the virus can remain dormant in the body and reactivate later in life, leading to shingles. Scientific research has shown that the risk of developing shingles increases with age, particularly after 50. The Centers for Disease Control and Prevention, CDC, estimates that 1 in 3 people will develop shingles in their lifetime, and it is more common in older adults due to a weakened immune system. The itching that accompanies shingles often starts before any visible rash appears, making it easy to overlook. Once the rash develops, it can be intensely painful, and in some cases, the itching persists even after the rash has healed, leading to postherpetic neuralgia. For example, take the story of Margaret, a 70-year-old woman who began experiencing intense itching along her back. She initially thought it was just dry skin and applied lotion, but the itching worsened, and she developed a rash along one side of her torso. Margaret's doctor diagnosed her with shingles and explained that the virus had reactivated in her body. She was prescribed antiviral medication to reduce the severity of the outbreak and prevent complications. Fortunately, with treatment, Margaret's shingles symptoms improved, but she continued to experience itching and discomfort even after the rash healed. Her doctor explained that this was a result of postherpetic neuralgia, a common lingering effect of shingles. Margaret's experience highlights the importance of not ignoring persistent itching, especially when it's localized to specific areas like the back or spine. If you or a loved one experience unexplained itching, especially with the development of a rash, it's crucial to seek medical advice. Early intervention can prevent complications like postherpetic neuralgia and allow for better management of the condition. Point 5. Itchy neck and chest. Itchy skin around the stomach or abdomen can often be associated with conditions like dry skin or minor irritation, but it can also be a sign of liver disease, particularly in seniors. As we age, the liver's ability to function efficiently can decline due to factors like the accumulation of toxins, fatty liver disease, or liver cirrhosis. One of the key symptoms of liver dysfunction is pruritus, or generalized itching, which often affects areas like the abdomen, arms, and legs. This is caused by the buildup of bile salts in the skin when the liver is no longer able to process them properly. Scientific studies support the link between liver disease and chronic itching. A 2014 review published in the American Journal of Gastroenterology found that pruritus is one of the most common and distressing symptoms in individuals with liver disease, particularly those with cholestasis, a condition where bile flow is impaired. This type of itching is often intense, persistent, and doesn't respond well to typical anti-itch treatments. In some cases, the itching may worsen at night and affect the quality of life, leading to anxiety, sleep disturbances, and depression. As liver function continues to deteriorate, the itching may become more widespread, affecting larger areas of the body. Consider the story of George, a 74-year-old man who started experiencing severe itching around his abdomen and stomach. At first, he dismissed it as just dry skin, but as the itching became more intense and widespread, he sought medical help. Tests revealed that George had non-alcoholic fatty liver disease, NAFLD, a condition where fat accumulates in the liver without alcohol consumption, leading to inflammation and reduced liver function. His doctor explained that the itching was due to the buildup of bile salts under the skin, a common symptom of liver dysfunction. George was prescribed medication to help manage the itching, and his doctor recommended dietary changes, exercise, and regular monitoring of his liver function. While the itching improved with treatment, George's experience emphasized the importance of early diagnosis and intervention in managing liver disease. George's case demonstrates how something as simple as itching could be a warning sign of a serious underlying condition like liver disease. Seniors should pay attention to persistent or unexplained itching, particularly around the abdomen, and seek medical advice. Early detection of liver issues can lead to more effective management and improve quality of life. Point 6. Itchy arms and hands. Itchy arms or legs in older adults can sometimes signal issues with the kidneys, especially when accompanied by swelling or changes in urine output. As we age, the kidneys naturally lose some of their filtering ability, making it harder for the body to remove waste products effectively. This can lead to a buildup of toxins in the blood, which can cause itching, a condition known as uremic pruritus. Uremic pruritus is particularly common in people with chronic kidney disease, CKD, and can be distressing, as it may not only affect the arms and legs but can spread across the entire body. The exact cause of the itching isn't fully understood, but it's thought to be linked to the accumulation of waste products like urea and creatinine in the skin, which can trigger irritation and inflammation. Scientific studies confirm the strong connection between kidney function and itching in older adults. A study published in Nephrology Dialysis Transplantation showed that uremic pruritus affects up to 50% of people with end-stage renal disease, ESRD, the most severe form of kidney disease. The condition is often more severe in seniors, who are at higher risk for kidney problems due to factors like high blood pressure, diabetes, and the natural aging process. Uremic pruritus can be extremely frustrating, as it doesn't always respond well to over-the-counter anti-itch treatments and may require specialized medical care to manage. Take the case of Barbara, a 69-year-old woman who had been living with high blood pressure for several years. Over time, she began to notice a persistent, irritating itch on her arms and legs. She initially thought it was just dry skin or an allergic reaction, but when the itching became more severe and she developed swelling in her lower legs, she visited her doctor. After several tests, Barbara was diagnosed with early-stage chronic kidney disease, CKD. Her doctor explained that the itching was likely due to the buildup of waste products in her bloodstream, a common symptom of kidney dysfunction. Barbara was referred to a nephrologist and started a treatment plan that included controlling her blood pressure, dietary changes, and medication to help reduce the buildup of toxins. Gradually, her symptoms improved, and the itching subsided. Barbara's experience highlights the importance of paying attention to unusual symptoms like persistent itching. In seniors, it can be a sign of kidney issues, and early intervention can help slow the progression of the disease and improve quality of life. Regular checkups and monitoring kidney function can help identify problems before they become severe, reducing the risk of complications like uremic pruritus. Point 7. Itchy groin and inner thighs. Itchy skin on the face, especially around the eyes, can be a sign of an allergic reaction or more serious underlying conditions, such as autoimmune diseases or skin conditions like eczema or rosacea. As we age, our skin becomes more sensitive, and immune responses may change, making seniors more susceptible to allergies or skin conditions that trigger itching. Itching around the eyes is particularly concerning, as the skin in this area is thinner and more delicate, which can lead to further irritation and even infections if left untreated. This type of itching can be caused by many things, including exposure to allergens like pollen, dust, or certain skincare products. However, when the itching is persistent or severe, it may be a signal that something more serious is at play, like an autoimmune disorder such as lupus. Scientific research shows that seniors are at higher risk for autoimmune diseases, which can cause skin issues like itching or rashes. A study published in the Journal of Dermatology noted that older adults are often diagnosed with conditions like lupus or rheumatoid arthritis, which can present with symptoms like facial rashes or itchiness. In lupus, for example, itching is a common symptom, particularly when the disease affects the skin. Additionally, skin conditions like rosacea, which is characterized by redness and visible blood vessels, can cause intense itching on the face, particularly around the nose and eyes. These conditions tend to worsen with age due to changes in the immune system. For instance, take the case of Linda, a 72-year-old woman who began experiencing itching and swelling around her eyes. At first, she thought it was just a reaction to a new facial cream, but the symptoms persisted and worsened over the next few weeks. Her eyes became puffy, red, and irritated, and she was unable to find relief with typical anti-itch treatments. After visiting her doctor, Linda was diagnosed with lupus, a condition she hadn't been aware she had. Her doctor explained that lupus can cause skin rashes and itching, and the facial area is particularly sensitive. Linda started treatment for lupus, which included medications to control inflammation and reduce flare-ups. Over time, the itching subsided, and Linda was able to manage her condition more effectively. Linda's experience serves as a reminder of how important it is to take persistent facial itching seriously, especially when it's not tied to an obvious cause like a skincare product or allergen. For seniors, changes in the immune system can make them more vulnerable to conditions that cause itching and rashes. Seeking medical advice early on can help with the timely diagnosis of conditions like lupus or rosacea, allowing for better management and improved quality of life. Itching can be more than just a nuisance, it can be a signal from your body that something isn't quite right. By paying attention to these itchy areas and understanding their potential causes, you can take proactive steps toward better health and possibly extend your life. Remember, it's always important to listen to your body and consult with your healthcare provider when unusual or persistent symptoms arise. Don't ignore the signs, taking action early could make all the difference in your health and longevity. Have you experienced any of these itchy areas recently? Don't wait, take action today and share your experience with others who might be going through the same thing. Make sure to consult your doctor to address any concerns early on, as prevention is key to living a longer, healthier life. Don't scratch the surface, take control of your health today.